Hi, my name is Francesca Vallejo, and today we're going to be talking about the socioeconomic factors contributing to social stress. So the introduction to the research topic. The research question: what are the socioeconomic factors that contribute to the development of social stress? This research topic will be focused on identifying the possible socioeconomic factors, for example, education, income, occupation, that influence the development of social stress within an individual. Multiple social factors, including social status, income, and education level, all play a significant role in increasing the chances of an individual developing social stress, thus further resulting in ill health. Since these factors can negatively impact the physical and mental health of an individual, it is of great importance to understand the socioeconomic factors influencing the development of social stress. So the importance and contribution of the research topic. This research topic interests me because since there are many people that are suffering from large amounts of stress in their daily lives, I want to be able to identify and gain a deeper understanding of the socioeconomic factors that can be contributing to their stress burdens. As mentioned by Waits, social stress consists of situations that causes an individual to experience anxiety, the emotions that result from exposure to such situations, and the bodily changes that result from a response to these situations and emotions. It is of great importance to determine the potential socioeconomic factors that are influencing the development of social stress and negatively impacting the physical and mental health of an individual. This research topic greatly contributes to the population that is being studied. Since I am conducting this research on a diverse population, I will be able to further examine how social stress affects those among different age groups. I believe that social stress can affect a variety of people and even those of different age groups. By conducting this research on a diverse population, I will be able to learn more about the socioeconomic factors that contribute to social stress and how it varies among different races, gender, ages, etc. Now on to the literature review. One of the socioeconomic factors that can increase the chances of experiencing emotional distress is facing economic hardships such as unsteady employment and low income. Experiencing economic hardships can also negatively affect the psychological well-being of an individual. In the study conducted by Vansberger et al., their main focus was to further investigate the environmental factors contributing to the stress burdens and challenges experienced by families in poverty. The authors hypothesized that economic hardship, such as living in poverty, can increase the levels of stress and strain within the family household. This study consisted of 128 participants that represented families living in poverty, where only the mothers of the families were asked to complete the questionnaire that was utilized in the study. The research method that was utilized in the study assessed the specific challenges that the families were currently experiencing and how the various socioeconomic factors contribute to their overall stress burdens. The findings of the study reveal that financial hardships was the factor that was contributing most to their increased stress levels. As mentioned by Vansberger et al., the financial hardships consisted of not being able to pay their bills or not having enough money left over after paying all of their bills. The results of the study also demonstrated how economic hardship has caused families to become faced with more challenges such as lacking transportation and parenting challenges. Similar to the previous study, Mostakowski conducted a study to investigate the economic risk factors that contribute to the development of social stress. Mostakowski mentioned that the factors associated with socioeconomic statuses, including income, education level, and occupational status, can all contribute to the increased stress levels experienced by individuals and families. It was hypothesized that lower levels of SES in families, such as low levels of occupational status and parental education, can contribute to higher levels of social stress and can increase the chances of experiencing depressive symptoms. Mostakowski administered the National Longitudinal Survey of Youth to 12,686 participants in order to measure the respondents' cumulative exposure to poverty and the effects of economic hardship. The findings of the study revealed that there were various factors that were associated with the family's SES that can contribute to their increased stress levels and depressive symptoms. The results reveal that there is a positive correlation between lower levels of parental education and occupational prestige and depression. In addition, the findings revealed poverty is a significant risk factor for developing chronic stress and depression. Masakowski concluded that a family's exposure to economic hardship can increase the chances of experiencing higher levels of social stress and can negatively affect their mental health. As it was mentioned by the previous articles, some of the factors that influence the development of social stress are low levels of parental education, occupational status, and household income. With that being said, it is of great importance to understand that socioeconomic stress not only affects adults, but it can also negatively impact children and adolescents. In the study conducted by Helm, Lubman, and Ace, the main purpose of this study was to gather more information about the specific economic factors that contribute to social stress within the family household and how it impacts the health and well-being of the children and adolescents within the household. It was hypothesized that environmental stressors are responsible for having a negative impact on the health outcomes of the children and adolescents. Helm et al. Administered the German Health Interview and Examination Survey for children and adolescents, which included physical examinations and tests, questionnaires, and a personal interview performed by the physicians of the study. The research methods that were used in the study measured the social environment and living conditions, family structure, and psychological well-being of the participants. The findings of the study revealed that there was a significant and positive correlation between social status and environmental stressors. It was also revealed that the emotional and behavioral issues found in the children and adolescents of the study can be a result of the stressing conditions within the household. Helm et al. Concluded that environmental stressors can contribute to the development of behavioral and emotional problems in children and adolescents. This study also demonstrated how a family's SES can contribute to the development of socioeconomic stress and can negatively impact the overall health of an individual. Similar to the previous studies, Gallo et al. Examined the correlation between stress and SES. In the study conducted by Gallo et al., their main goal was to identify the possible correlations between low SES, stress, and physical health outcomes, and how it varies among different socio-demographic groups. The authors hypothesized that Latinos will experience poor health outcomes due to their exposure to social stressors such as poverty and discrimination. Gallo et al. Gathered a sample of 318 Mexican-American women between the ages of 40 to 65 years and had them fill out a self-report questionnaire that assessed SES, including education and income, and their current stress levels. The findings of the study revealed that the participants that had a higher SES reported having lower levels of stress. Gallo et al. Also mentioned that the results revealed that there was a positive and statistically significant correlation between low SES and chronic stress. This information demonstrates that low income and education levels can increase the chances of developing and experiencing chronic stress. Gallo et al. Concluded that the results of the study provided important insight into the relationship between SES and stress. Lastly, in the study conducted by Adel and Cheng, their main goal was to further examine the correlation between the adverse effects of low SES and poor health-related quality of life. The present study addressed this issue by measuring the levels of perceived stress in individuals with low SES. The authors hypothesized that there will be a positive correlation between low SES and individuals that are experiencing higher levels of stress. In order to test their hypothesis, Adel and Cheng utilized questionnaires that were individually administered through household interviews. The questionnaires measured the participants' SES characteristics, for example, education level, household income, and occupational status, and their current stress levels. The results of the study revealed that there was a positive correlation between those who experienced high levels of stress and reported having low SES. The data also revealed that both SES and stress are risk factors that can negatively impact an individual's health-related quality of life. Adel and Cheng concluded that their findings enriched the literature by uncovering the socioeconomic factors that are contributing to the increased stress burdens experienced by individuals that are a part of socioeconomically disadvantaged groups. Now for the research method. In order to gain valuable information that will help me answer my research question regarding the socioeconomic factors contributing to the development of social stress, I chose to use the survey research method. The survey that was administered in my research study is in the form of a questionnaire, which contains questions that will help me gain more insight into my research topic. So why was it chosen? The survey research method is one of the most commonly used methods in social science research. One of the benefits of utilizing the survey research method is that it allows the participants to express their personal ideas while remaining completely anonymous. One of the reasons why I chose to use the survey research method is because I would be able to administer the survey onto large social media platforms such as Facebook, Instagram, and Twitter. By administering an online questionnaire with questions concerning the socioeconomic factors that can be contributing to one's overall stress can help me easily and efficiently gather vital information about my research topic from a diverse population. How is it a good fit for the research question? Utilizing the survey research method would be a great fit for gathering vital information and will help me find answers to my research question. In the questionnaire that I created, I was able to tailor questions that will help me inquire more information about the diverse population that is completing the survey and their personal views on the socioeconomic factors that are contributing to their overall stress levels. For example, the first 5 questions are demographic-based questions that ask the participants' age, gender, ethnicity, and education level, and their current socioeconomic status. These questions are important to the study because it will provide me with more insight into how the stress levels of the individuals differ according to their ethnicity, gender, and socioeconomic status. The last 5 questions of the survey relate specifically to the possible factors that are contributing to their social stress and the strategies they use to help manage their stress. I made sure to include socioeconomic factors such as education level, household income, family issues, financial issues, and job-related issues as possible factors as to why they are experiencing large amounts of stress. The responses I received from those questions will help me gain more important information about the relationship between SES and increased stress levels. In addition, it was important to inquire more information about the techniques used by the participants to help manage their stress levels. Since experiencing large amounts of stress can take a negative toll on one's health, it is important to identify the effectiveness of the participants' coping skills for managing their stress. Now for the research hypotheses. So hypothesis number 1. I believe that the majority of the participants that are experiencing higher levels of stress will report having a lower SES. For example, those that have a lower SES will report having higher levels of stress compared to those who have reported having higher SES. The reason for this hypothesis is because most of the articles that I have reviewed on this topic reported that there was a strong correlation between low SES and high stress levels. Also, research has shown that those who reported having a higher SES reported having lower levels of stress. Hypothesis number 2. I believe that the factors that are contributing most to the participants' overall stress burdens are financial issues and family issues. In my opinion, I believe that financial strain within the family household can not only add to one's stress burdens, but can also have a negative impact on the family unit as a whole. For example, struggling financially can increase the stress levels among the individuals within the family and increase the chances of developing further problems among the family members. For example, behavioral issues, emotional issues, and health issues. Hypothesis number 3. I believe that most of the participants will report that their personal methods for relieving their stress is eating and talking with others. In my opinion, I believe that when people experience large amounts of stress, they tend to stress eat. Also, for many others, I believe that people find relief in talking to others about their problems and stresses in life. Whether it's over the phone, throughout social media platforms, or in person, I believe that most of the participants will report that talking to others help them lower the amounts of stress they are currently experiencing. Now for the research limitations. Limitation number 1. The first limitation of this research study was the sample size. Even though I administered the survey throughout large social media platforms, including Facebook, Instagram, and Twitter, I was only able to obtain 20 participants that chose to participate in my survey. Even though I was not able to have a large sample size for this study, I still strongly believe that I was able to gain valuable information regarding the socioeconomic factors contributing to one's social stress. Limitation number 2. The second limitation of this research study is the risk of dishonesty among the answers given by the participants. It is important to be aware of the fact that it is possible that some of the participants that completed my survey were not completely honest with their answers. That is one of the potential problems that can arise from using the survey research method. Since there are people that may answer dishonestly to the questions on a survey, this can cause the data to become inaccurate. So now for the important research findings. So what is your ethnicity? So the significance of this finding is that the majority of the population that participated in my survey were Hispanic or Latino. This is important because I will be able to see how the stress levels experienced by Hispanic Latinos vary among the other ethnic groups. As mentioned by Waits, Hispanic Americans experience an array of health issues linked to poverty and chronic stress. These findings will help me determine if Hispanic Latinos experience greater stress burdens compared to other ethnic groups. So what is the highest level of education you have completed? Education level is a socioeconomic factor that is known to contribute to the development of social stress experienced by an individual. For example, research studies have shown that those that have lower education levels experience higher levels of stress. The results of my study has revealed that the highest level of education completed by the majority of the participants was high school. In comparison to those who have higher education levels, those that have lower levels of education are experiencing higher levels of stress. How would you describe your current economic condition? Economic status is another socioeconomic risk factor that plays an influential role in the development of social stress. For example, prior research studies have found that those who have lower SES report having increased stress levels and poor health-related quality of life. The significance of this finding is that the majority of the participants describe their current economic condition as being a part of the lower class. The results of this study have shown that those who have reported having low SES experience higher levels of stress compared to those who reported having a higher SES. How would you rate your daily stress levels? The significance of this finding was that the majority of the participants reported having high levels of stress. It is evident that there are either socioeconomic or environmental factors that are contributing to their high stress levels. With that being revealed, it is crucial to further investigate the socioeconomic factors that may be contributing to their high levels of stress. As the previous findings revealed, most of the participants have reported having lower SES, which could be the potential risk factor that is contributing to their high levels of stress. What are the usual causes of stress in your life? The significance of these findings revealed that financial issues was the main cause of the participants' increased stress levels. Previous research has shown that there is a strong correlation between low SES, for example, low income and poverty, and increased stress levels. These findings also support my hypothesis that financial difficulties will be one of the factors that contribute to the overall stress burden of an individual. It can be seen that low income is a socioeconomic risk factor that contributes to the development of social stress within an individual. What are the personal methods you use to help relieve your stress? It is of great importance to gain an understanding of the strategies used to help an individual manage their stress levels. High levels of stress can not only result in poor health-related quality of life, but can also negatively affect one's physical and mental health. These findings reveal that the most commonly used method to help relieve the stress among the respondents was talking to others. These results support my hypothesis that talking to others could be the most efficient coping mechanism that an individual uses to help manage their high stress levels. Now for the research discussion. After further analyzing the results from my study, I was able to gain valuable information regarding my research topic, which also provided me with answers to my research question. As mentioned by Waits, the likelihood of experiencing social stress depends on one's position in society. As I analyzed the findings of my study, I was able to determine whether or not there was a correlation between one's position in society and increased stress levels. The results of the study revealed that those who have a lower education level and low income level experience higher levels of stress. As it was mentioned by Waits, individuals with lower incomes and education levels experience higher levels of stress than those who are more affluent and better educated. The results of the study also support the research findings of the study conducted by Gallo et al., which was that Latinos experience higher levels of stress due to social stressors, for example, poverty. Since the majority of the participants of the study were Hispanic Latinos, it can be seen that this ethnic group suffers from having high levels of social stress. With that being said, it is important to take into consideration that social stress affects all ages and various ethnic groups. Also mentioned by Waits, social stress can result in physical and mental health problems within an individual. Since social stress can negatively impact an individual, no matter their race or age, it is important to identify the possible socioeconomic risk factors that contribute to one's overall stress burden. The findings from the study provided insight into the socioeconomic factors that contribute to the high levels of stress experienced by the participants of the study. It was revealed that lower education levels, low socioeconomic status, and financial issues were the factors associated with developing higher levels of social stress. From a sociological perspective, it is believed that poverty exposes individuals to a variety of stresses such as hunger, poor living conditions, and worries over bills. It is these factors that are contributing to individuals experiencing high levels of stress, thus negatively affecting their physical and mental health. Since social stress can lead to illness, it is important to develop a further understanding of how individuals choose to manage their stress and the efficacy of their preferred coping mechanism. Waits mentioned that the likelihood that stress will affect one's health depends on how individuals appraise the stress and how they decide to manage the stress. For those reasons, I decided to include questions that ask the participants the methods they use to cope with their stresses and how effective their coping techniques are. The majority of the participants reported that talking to others is the most effective method they use to help relieve their stress levels. This specific coping mechanism has shown to have helped the respondents manage their high levels of stress, while also helping them maintain their emotional and psychological well-being. All in all, my research findings has allowed me the opportunity to gain more insight into the possible socioeconomic risk factors that contribute to the social stress experienced by an individual and how social stress varies among a diverse population. In addition, I was also able to learn more about the methods used by individuals to help manage their stress levels. It is of great importance to be able to identify what specific coping mechanisms work best for relieving stress. By doing so, this can help others reduce their high levels of stress and prevent them from developing any further physical, emotional, or psychological issues. Implications for future research. Future research should further investigate how social stress influences the development of health risk behavior in low SES communities. By doing so, we can gain more information regarding the relationship between social stress, low SES, and health risk behaviors. It is important to identify the factors underlining the association between social stress and health risk behaviors in low SES communities. By doing so, we will be able to understand the preventative measures that need to be taken to reduce the chances of an individual experiencing health-related issues resulting from their high levels of stress. Future research should also attempt to find ways to decrease socioeconomic inequalities in order to help manage and limit the excessive amount of social stress experienced by various individuals. It would also be beneficial for future studies to investigate the ways in which to provide low SES families and communities with effective coping techniques that will assist them in managing their stress levels. Thank you so much for watching. I hope you enjoyed.